Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
And good morning. I'm Dr. Kim Allen Williams, Chair of Medicine here at University of Louisville, and today we had our wonderful grand rounds. It was highly informative, given to us by Dr. Shahab Ghafghazi. He is our section chief for general cardiology and a fantastic imager. And he talked to us today about the forgotten valve, the contemporary approach to tricuspid regurgitation. Dr. Ghafghazi, can you summarize your talk in 1 minute?
Sure. So tricuspid regurgitation for many years was not treated. We did not have any devices to treat that, and that's changed. And so it's important for us to recognize what happens with tricuspid regurgitation, follow that in terms of its severity, and when patients start having symptoms, or sometimes perhaps even before that, try to offer them a multimodality treatment, which includes everything from medical treatment to surgical treatment to transcatheter treatments.
Well, that was really spectacular. It was highly informative and help us keep the flow going forward.
Thank you
so much. And this has been a Cardinal Minute.